WION is continuing to bring you all the latest updates about the coronavirus pandemic. The death toll from the new virus has now reached a whopping 2,347, with more than 76,200 cases around the world. 109 deaths were reported in China overnight. Amidst the growing outbreak, China has seen a drop in the number of new infected cases. Compared to the 900 new cases reported on Friday, the number dropped to just 397 overnight. Meanwhile, China's ruling Communist Party has said that the outbreak in the country has not yet reached its peak. In a Politburo meeting chaired by President Xi Jinping, the party said, and I quote, "A turning point in the development of the national epidemic situation has not yet arrived. The epidemic prevention and control situation in Hubei province and Wuhan city remains severe and complex." While the virus has impacted the Chinese economy, the government believes that the economy's long-term improving momentum will not change. Meanwhile, contrasting claims about the virus make it difficult to contain it as this global contagion continues to take more and more lives. The local government has now said that the virus's incubation period could be much longer than the presumed 14 days. This comes as a man who was infected with the virus showed symptoms a record 27 days later. A longer incubation period could complicate efforts to contain the spread of this virus. In another incident, a 20-year-old Chinese woman from Wuhan city with no symptoms of the virus has now infected 5 of her relatives. This brings back the fear of individuals without any symptoms spreading the virus. According to the study, all 5 of her relatives developed Covid-19 pneumonia, but the young woman is said to develop any symptoms. Such developments make the prevention of the virus far more challenging. Amidst growing fears, the World Health Organization has stepped up its battle against the virus. The WHO warned that the window of opportunity to contain the spread of the epidemic is narrowing.
The window of opportunity is still there, but our window of opportunity is narrowing. I would put it that way, narrowing. And that's why we called the international community to act. And that's why I explained yesterday, although we're asking for the international community to act quickly, including the financing, that's not what we see.
This comes as new cases are reported in Iran, Lebanon, and South Korea. In fact, the latest individual to contract the disease in Iran is the mayor of District 13 of the capital, Tehran. 26 other countries have reported more than 1,000 cases and 8 deaths. While the World Health Organization appreciated the countermeasures undertaken by China and other countries, it asked them to continue the containment measures while preparing for a possible community transmission. At the daily press briefing, the World Health Organization's Director General also announced the appointment of 6 special envoys on the coronavirus in different parts of the world in an effort to battle the outbreak.
So pleased to announce today that we are appointing 6 special envoys on coronavirus, on COVID-19, to provide strategic advice and high-level political advocacy and engagement in different parts of the world.
Now, Iran has reported another death due to the new coronavirus, and that takes the total death toll in the West Asian country to 5, while 28 people till now have been affected. The death has been reported among the 10 new cases reported in Iran recently. Iran has now reported 5 deaths in the last 3 days. The outbreak in Iran started in the holy city of Qom, a city often visited by many devotees. Health authorities fear that the virus could quickly spread to other regions in the country, taking the situation out of control. An Iranian health ministry official has already said that it is possible that the virus is already existing in all Iranian cities. What compounds the fear of a possible pandemic in Iran is the situation of its healthcare system. Iran now has one of the worst death-to-infected ratio, a clear indication towards its ability to diagnose and treat the deadly virus. Now let's take a look at the larger picture of the situation in West Asia. Coronavirus has claimed 5 lives with 28 others infected in Iran alone. Lebanon and Israel have confirmed their first cases. Iraq, meanwhile, has closed its border crossings with Iran. Kuwait is also heightened state of alert. This is a reality check on the surge of the epidemic in West Asia, which raises a big question. Will West Asia be the new center of the outbreak? Fears are not unfounded. West Asia remains one of the most underdeveloped regions in the world. Needless to say, the healthcare system might not be able to handle a possible pandemic. Borders between West Asian nations remain permeable, which could facilitate the spread. Emergence of new cases has sent alarm bells ringing, with the WHO, or the World Health Organization, fearing that the West Asian nation of Iran could emerge as a new epicenter for the virus. Asked if the emergence of new cases had put the crisis on a tipping point, WHO's Director General said, and I quote, "The window of opportunity is narrowing, so we need to act quickly before it closes completely." And now being joined by West Asia analyst Mayor Javed Anfar, live from Tel Aviv in Israel. Mayor, as always, a pleasure having you here on the broadcast. But talk to us about the situation in West Asia. We've seen cases now in Iran and in Lebanon and in Israel.
Yes, we have. In Iran, it seems to be most severe at the moment. After the Iranian authorities are taking some measures, they've started disinfecting some of the parts of the metro of Tehran. They've started issuing a quarantine for those who've been diagnosed. But right now in Iran, it seems that the authorities were caught out by surprise, although one has to ask that whether some of the policies by the Iranians contributed to this situation. We have to remember, Mr. Kumar, that while the international community, many of the airlines were cutting flights to China, in Iranian airlines, various Iranian airlines such as Mahan Air, they increased flights to China in order to pick up those passengers who were not being transported by other carriers because of the coronavirus scare. So there is some criticism in Iran regarding how it's been handled. For example, yesterday there were elections, there were parliamentary elections. The government did not stop them. This is a public event. A lot of people come out to vote. And when you're facing a crisis such as Corona, some people say that there should have been more precautions should have been taken. So some precautions are being taken. However, there are some serious questions about how the Iranian government has been handling the coronavirus so far.
Right. So the problem of the poor status of Iran's healthcare system is going to be the biggest hurdle when it comes to containing the pandemic in Iran. But what about Israel? Talk to us about Israel. Israel has a much better healthcare system than Iran, and cases have been reported in the country.
Correct. We've had a case here in Israel. One of the passengers on a ship that was in the Far East, they were quarantined, and upon return, it's been detected. This is something that, yes, Israel is smaller than Iran. Israel is a very, very smaller country, and because of the security situation, our borders are sealed, whereas other countries in this region, their borders are not sealed. I mean, God forbid, Mr. Kumar, just imagine if coronavirus reaches Syria, if it reaches Italy, in the catastrophic health system that there is in Syria as we speak, and especially in Idlib. These are the areas that worry me. Afghanistan really worries me. Your neighbor Afghanistan really worries me. There's a lot of, the border between Iran and Afghanistan is very porous. And, it will take a couple of infected people to go to Afghanistan with a very, very bad health care system. And of course, let's not forget Pakistan, which could also be another disaster because of the shared border. These are the countries that worry me the most right now are Syria and Afghanistan. And of course, it could be in Iraq as well. But for now, Israel seems to be containing it. The Lebanese are doing a good job of containing it. But in Iran, as I said, there's a lot of, unfortunately, after the recent Ukraine airliner that was shot down, and for 3 days people were told that there was no missiles, and then there was a 180 degrees turnaround in that, and the government actually said, yes, actually there were 2 missiles. Public confidence in government announcements has collapsed, and this is what I think will make it more difficult to contain the coronavirus.
Right. 2 different stories in Iran and Israel. Mayor, I want to quickly ask you about Lebanon. You've been talking to us about the borders and how dangerous the spread of the pandemic could be in West Asia, in conflict regions. Lebanon situated crucially in that region, and Lebanon has not been spared by the coronavirus.
Yes, sir. And this is, again, the situation. That's what worries me about Syria, because the border between Lebanon and Syria is porous. And we have to wait and see how the Lebanese manage the situation. I think what makes the situation even more difficult, as your report said, is that some people don't show any symptoms for 27 days to a month. Mr. Kumar, not many countries can afford to keep their people shut indoors and not working for a month. This is what makes the situation even more difficult on top of porous borders in this region.
Exactly. You cannot keep people shut inside forever. Mayor Javed Anfar, our West Asia analyst, joining us with that perspective here live on the broadcast from Tel Aviv in Israel. Thank you, Mayor, for being with us. Now, sources have told WION World is one that China is deliberately delaying granting clearance to an Indian flight which will carry out evacuations in Wuhan city. New Delhi has reacted to the delay and has asked China for a permit. Indian officials are sure that the delay is intentional. This is sources tell WION World is one that China has been allowing other nations to evacuate their citizens from Wuhan. Sources also tell us that India had requested for a third flight to Wuhan back on the 13th of February. It submitted the flight plan 2 days later, that is on the 15th of February. In fact, France was allowed to carry out rescue operations on the 20th of February, the day India's flight to China was scheduled to take off. According to sources, Japan and Ukraine carried out evacuations on the 16th and the 17th, respectively. India, which has already evacuated over 600 of its citizens from Wuhan city, has been ready to send another flight to rescue its remaining nationals. Beijing maintains that there has been no delay, but has so far offered only vague explanations on the matter. The Chinese embassy in India has said that the prevention of the virus in Wuhan has entered a critical stage and that the ground situation has changed. Unlike the last time in which operations were carried out by civilian jets, this time around India is sending a military aircraft. On February 17th, New Delhi had announced that it will send the Indian Air Force's largest plane, the C-17 Globemaster, to rescue all its nationals from Wuhan. The plane will also be carrying medical supplies for China. And this weight comes even as China has said that it attached high importance to the lives of the foreign nationals in the country.